Heart to heart with Abba Gabba. Heart to heart with Abba Gabba. Hello and welcome to Heart with Abba Gabba, a podcast in honor of celebrating families and everything about children, beginning with us. Confidently, this will inspire and encourage us to listen, defend, and advocate for our infants, toddlers, preschoolers, school age children, teenagers, and all children from across the board to help us see the world from their perspectives and offer support throughout their stages of development. Celebrate! Heart to Heart with Abba Gaba is sponsored by Staff Smart, your one-stop destination for staffing and non-medical concierge services for adults, teens, and children. For more information, I encourage you to visit www.staff-smart.org and by phone 480-875-6871. You are listening to Heart with Abba Gaba with your host, Abby Dominguez. Do you want to know how to improve your oral hygiene beyond the basics? This podcast is for you. Today, I am excited to bring you a heart to heart with Dr. Yasaman S. Roland. Her whole body approach to dentistry opens parents' eyes to how our body systems must work in harmony and what to look out for as children develop. Dr. Yasaman, welcome to Heart with Abagaba. I am conversing with you from Mesa, Arizona. Please tell our listeners where we are connected from and share a short bio.
Thank you. Yes, I would like to let you know, introduce myself and let you know that I am also a mom of four, and watching my children grow is very important. Seems like there is a similar outlook. And for me, as a practitioner and as a mom, I focus on how the children can grow and develop and be able to have lots of energy and enjoy their life. And I focus on basically keeping them and guiding them into having a very healthy structure and nutrition so that they will grow into healthy adults.
Wonderful. I love that. Thank you so much for sharing that. And can you help our listeners understand how our body systems affect each other, how the teeth, jaw, breathing, neck, and spine interact?
Oh, yes, I always say the body is very much interconnected. So we have our jaw, which is essentially the home for all of your teeth.
Hmm.
And that jaw is connected by a very delicate joint called the TMJ
Hmm.
to the skull, which is essentially your head. And that skull is supported by the top part of the vertebra called the atlas. And after that, you have your axis, which helps your head rotate. And then from that extends the rest of your spine all the way down to your sacrum. And then you have your rib cage in the front of the spine, which supports very important organs like your lungs and your heart.
Hmm.
And then from the very bottom of the pelvis, you have, of course, your legs extending.
Hmm.
So um, everything works together as a whole.
Yeah.
So the way that your teeth are connecting inside that home can actually affect the way the rest of the structures line up or connect as well, or it could be vice versa. So it's very important for your body to have this nice balance and structure so that there's a enough space and enough uh, alignment so that those teeth can connect and you can chew and swallow good.
Yes. Wonderful. So you mentioned TMJ. TMJ can be very painful and affect so many people. Explain how you have been successful in diagnosing the root cause and solving this often difficult to treat disorder.
Well, I'm focusing on how the body is connected, just like I explained. And it's all about making sure that all those parts, all the anatomy is within in good alignment.
Hmm.
And the body likes space and the body likes to be centered.
Yes.
So it's important for all those to be following that guideline. And a lot of times when something is out of alignment on the inside,
Mm.
for example, if there's not enough room for the teeth,
Yes.
or if teeth are not correctly lining up, that will throw off the supporting structures like the jaw. It will become out of alignment because your body is trying to compensate
Mm.
for what is missing. And so it starts to work harder than normal, and those muscles that support those bones start to cramp up, and
Oh.
it starts to become painful. And that is something that may not be recognized
Mm.
as the kids are growing,
Mhm.
but as they mature and all the bones are done growing and they form into adulthood, then when that chronic condition repeats itself,
Mm.
then those symptoms start to simmer.
Wow. Wow. That's really informative. Thank you so much for sharing that. Can you really reduce the need for orthodontics for some children?
Well, I think it's important when you look at a lot of children today, and you notice that their teeth are really crowded.
Hmm.
There's not enough space, in which means their home, that jaw doesn't have enough space. It's too small. So those
Yeah.
teeth become crowded.
Hmm.
But something else to look at and think about is that if that jaw, the upper portion, which we call the maxilla, and the lower portion, which we call the mandible, if they don't have enough space for those teeth, that means that somehow the body's going to compensate to create more space. So
Oh.
that upper jaw is going to basically um, become compressed. A
Mm.
lot of times you can see if you look on the inside, the palate looks like it's high up
Hmm.
or it's a V shape because that's how the teeth are fitting in at this time.
Oh.
But something to consider is that when that happens, that maxilla being in that shape, it's really pushing on the structure of breathing, which is that nose, because that's right underneath.
Hmm.
So that's actually constricting that airspace.
Mm.
So now you see that the kids may have trouble with proper breathing. And proper breathing is important because when you take the air from the nose,
Mm.
that will create uh, oxygen, good oxygen
Yeah.
to go in. It's filtered air, and it's important to fuel your body and give you energy.
Hmm.
And that will be compromised if this is the situation. So a lot of times you notice that um, the kids may experience being more fatigue
Yeah.
or experience being very inflamed and not be able to breathe. They always have runny noses and
Oh,
there's
yeah.
inflammation in that entire area.
Mm. Wow. So how do teeth and jaw affect facial development as kids grow? I think you may have mentioned that already.
I,
I understand your approaches are focused on the proven work of others. Help us understand the basics for a whole body approach to dentistry and why it should matter to patients.
Well, it's very important, of course, to look at how the face essentially develops, because it all starts with proper breath.
Yes.
Uh, when you're exposed to fresh air,
Hmm.
that pressure of the air actually naturally helps expand those sinuses. And that
Oh.
pressure helps extend the middle of your face,
Mm.
the maxilla that we discussed.
Yeah.
And with that nice development, that creates good space for your teeth to come in. That creates a good, comfortable space for the muscles to work. A big muscle inside of the mouth is actually the tongue.
Hmm.
So that means that that tongue also will have good space to help you swallow
Hmm.
correctly.
Yeah.
Um, it helps with proper positioning to help the person breathe properly. Because if there's not enough space in there, a lot of times that tongue may not be resting in the roof of the mouth,
Oh.
which helps you with proper breathing techniques. And a lot of times, if that is the case, that tongue starts to position itself on the lower part of the jaw, which will help the person grow down and narrow and compress that jaw as well,
Hmm.
which will create compression of the skull, the jaw, and all the surrounding structures.
Wow. So I know that it's so good for children to have an outdoor time, like at least 1 hour a day. Now I have a deeper understanding of why that could help the teeth grow and breathing and help them grow and develop. Thank you so much for sharing that. So, what are the symptoms that could indicate that people will benefit from your approaches?
Well, I think if you see someone who cannot close their lips, for example,
Hmm.
that means that they're not using their nose to breathe. You see
Right.
a lot of crowding inside with the teeth,
Yeah.
or you see that they're always chronically inflamed.
Right.
Uh, you see that their structures of the face are forming more narrow and long. Maybe the profile doesn't have that stronger jaw appearance.
Hmm.
It's being compressed. You might notice some purple or darkness or circles under the eyes.
Yeah. I've
You
seen
may notice,
those. Yeah.
yeah, you may notice that they cannot hold their head on straight, that
Mm.
they're more of a in a forward head posture.
Mm.
Um, so I would say those are the most important signs that you may be able to pick up to see if this person needs more help to develop correctly.
Yeah. Yeah. How do you improve a person's overall facial aesthetic with just non-invasive techniques?
Well, when I do some very easy techniques
Uh-huh.
to help the person regain their balance within the body.
Hmm.
It's a series of breathing techniques, myofascial techniques. I use certain appliances that are actually very specific for that person's situation
Uh-huh.
because we take very custom diagnostics to see how the person is developing and growing.
Right.
And based off of those specifics, we customize the functional appliances that are needed to redirect their growth to where nature actually intended them to go.
Oh, I like that.
So it basically helps reshape all of those internal structures, and we help them use those muscles now. We retrain those muscles to support those new bones that we helped shape and
Mm.
rearrange. And then the teeth will just blossom in place.
Oh, I love that. I
And
love the word blossom.
if they need a little bit of help, then it's a minimal amount of time to help them straighten and connect in that new structure that we created.
Uh-huh. Wow, that is so cool. Thank you so much for sharing that. I've been going to dentist for years, but it's like routine, but this is really deep, and I love that. It helps me better appreciate. From your
Mhm.
years of experience, what are some takeaways that will help people better maintain their dental and broader health?
I'm sorry, would you mind repeating that?
Oh, yeah. So, from your years of experience, what are some takeaways that will help people better maintain their dental and broader health?
Well, I always encourage natural ways of growth and natural ways of support for the body.
Uh-huh.
So when, little kids are growing, I really encourage parents to focus on their nutritional intake,
Nutritional intake. Okay.
um, meaning foods that do not have additives, foods that are not processed or ultra processed,
Yeah.
uh, foods that don't contain any artificial ingredients or colorings or
Yeah.
those things are very toxic to the body,
Oh,
create a lot of inflammation. And
oh.
the other way to look at this is the fact that those types of foods, the processed foods, are quite soft and mushy,
Mm-hmm.
which means that the children don't have to put any effort into
Oh,
chewing
yeah.
or exercising their jaw.
Yes.
Because in reality, when you exercise those muscles, they're going to pull on the bone and they're going to help the jaw grow naturally, the
Right.
way nature intended it to.
Right.
So if you take all those away, then they're not going to be able to do that.
Oh.
I would introduce them to foods that don't have any of these um, ingredients
Mm-hmm.
that are uh, hard to chew.
Uh-huh.
A lot of good vegetables,
Mm-hmm.
hard vegetables, um, foods that contain a lot of calcium,
Mm-hmm.
also with vitamins that help them absorb.
Yeah.
So I think nutrition is very important for kids that are just starting to grow. And when you create this space within the face, it also helps create that space to be able to breathe right as well.
Yeah.
So you're eliminating inflammation and you're helping them use their nose to breathe and help themselves naturally develop.
Oh, I love that. What are other types of practitioners or disciplines become involved with your treatment?
Yes.
Or,
Uh,
mhm.
I think I understand what you're
Yeah.
asking.
Thank you.
When I am treating patients, and especially children, when I am focusing on creating that rebalance and realignment within the body, I work with an osteopath,
Uh-huh.
um, an osteopath practitioner, which helps with rearranging that external part of the body, meaning alleviating any kind of strains within the cranium that exist or any kind of strains on the spine. So all of that can be rebalanced so that the rest of the structures also gain their balance back. And also, this osteopath as well will help with training your body to understand how to use the organs to breathe properly.
Hmm.
Or a craniosacral therapist who specializes in um, this development as well. So we can sometimes work as a team together
Uh-huh.
to help recreate that balance in the body for kids and adults. But a lot of times, kids are blessed with being able to self-correct,
Yeah.
so they don't need as much as the adults do for the introduction of the other practitioners. But in some situations, we might have to get the help to give them a boost.
Hmm. That's wonderful. I understand your approach is growing in popularity. Can people find dentists around the country offering similar types of treatments?
Yes, I think that we're probably in the minority at this time,
Hmm.
but if you are able to do some good research, you should be able to find some folks around the country because they are all over,
All over. Wow.
but not in great numbers.
But not in great numbers. Wow.
Correct.
Right, right. So I have little babies. I have twin babies. They just turned 1 on Friday, and I'm so touched by nutrition and giving healthy, fresh foods, like not processed. And I'm still thinking about that. And I've heard those before. I used to work in a Head Start program, so I knew that. But the way you explained here was just beautiful, and it's stuck with me. And I know that it's going to stick with my listeners as well.
Oh, good.
So, yes, really. My mind is just like when I'm done with the show, I'm gonna go to the store, go to the fresh produce aisle, we're gonna pick up broccoli, carrots, and we're gonna start over. If I thought I knew anything about nutrition, I'm gonna start over. Thank
Oh,
you so
well,
much.
very good.
Seriously, I am. My brain is just going ding. It's running.
You know,
And
in the stores, I see a lot of yogurts or a lot of squeezy drinks.
yes, I was gonna ask you about that. What's your recommendation or insight on those?
I mean, they are cute
Uh-huh.
and they're easy to use, but again, it does not help with exercising that facial development.
I would have to agree. Yes. Because in my program, I used to be a preschool teacher, and we used to say chew, 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 chew and swallow. How are they going to chew and swallow if there is nothing to chew and swallow, you know?
Right.
And I love that you mentioned nutrition. The vegetables are brightly colored and they're fresh, and
Yeah.
just naming the colors and eating the colors, and that just really that has stuck with me so much. I want to thank you so much. I can't help myself.
I am so happy this was good information.
It was. It is really good information. I'm really, really, really rethinking dentistry for my children as they grow. They just turned 1 year old, and I can do this right. I can help them do this right with this beautiful information that you shared. And do you have any final thoughts you want to share with us? You have the floor. You can share anything that you want to share with us. I would love to.
Well, thank you. I think honestly, I have shared everything I know. I just
Uh-huh.
think that it is so important to focus on healthy growth from the very
Yes.
start.
Uh-huh. Yes.
We, as the kids grow and have an understanding of why we are guiding them into this, they will hopefully engage in and take that with them as they grow into older individuals and want to make their own decisions. So they actually have that in the back of their mind and they can pursue those good words of wisdom and
Mm-hmm.
practices.
Mm-hmm. Mm-hmm. I really love that. And how I have one question that just came to my mind. Um, how can we make the whole body approach fun and engaging for kids and adults that we can have better health and just overall health? How can we make it more, put in the time and effort to make it more rewarding and more better health for us and our children?
Well, I would just think that it is, you can make, you can give them incentives to
Uh-huh.
be more engaged, because I know kids, and knowing from my own kids, because they're a little bit older, they're
Uh-huh.
definitely attracted to, the processed foods and
Yeah.
norm that's out there, because you have friends that want you to have the same thing, or
Oh yeah.
look prettier, or they're just more attractive. And I just think it's a good reason to celebrate
Hmm.
those.
Celebrate. I love that. Celebrate. Yeah.
It'll be very good to celebrate all the good decisions they make,
Hmm. Hmm.
hopefully through your guidance.
Yes. Yes. I totally agree. My daughter does not like the yogurt in the pouch. So maybe that's telling me something. And then I learned this today. I mean, I relearned this today. So yeah, yeah, I am sold on that. Oh my goodness, Dr. Yasmin, I want to thank you so very much for visiting us today on Heart to Heart with Abagaba. And thank you so very much for the wonderful work that you're doing, the
Thank you for having.
wonderful, awesome information that you have given us today. It did resonate with me deeply, and I know for sure that it could resonate deeply with my listeners as well. Have a fantastic day, and I look forward to connecting with you again sometime.
Wonderful. Thank you.
You are very welcome. Heart to Heart with Abagaba is also sponsored by Aspire Behavioral Health. They offer monitoring, counseling, medication, and personal care services in a beautiful residential setting. I encourage you to contact them at aspirecbh@outlook.com or call 480-875-6871. Please feel free to share this podcast with your friends, families, and loved ones. And if you would like to connect with me, the best place will be on my website, abigail.edominguez.com, or on social media. You can follow me on Instagram at author_Abigail_E_Dominguez. And we have a new YouTube channel at Heart to Heart with Abagaba. So please feel free to check us out also. And finally, I'd like to make a disclaimer that the stories and points of views we have shared on this podcast are personal and from our life and work experiences. We are not legal, medical, mental, or health advisors. Have an awesome day, and I look forward to connecting with you again on this platform. Be your light, be joyful, and as always, celebrate.